Welcome to our show on View on Public Safety. My name is Richard Aguiar. I am the Director of Fall River Emergency Management and the Deputy Chief of Special Services. Today we have a couple of great guests. First guest here is Lieutenant Billy Leonardo from the Fall River Fire Department. He's going to speak about safe stations for the fire department. And we have Michael Bryant, who is an expert on substance abuse, and he's going to speak about that. He's also the director of the Recovery Center at Stepping Stones. So first, I want to start off with Lieutenant Leonardo.
Chief, good morning, or good afternoon, I should say. Thank you for having us. We appreciate the opportunity to come here today and talk about safe stations. So we're here today because back in April, Safe Station hit its one-year anniversary. So it started back in March 1st of 2021. Originally, we had hoped to implement the program sooner, but because of complications that resulted from the coronavirus pandemic, COVID-19, the program screeched to a halt. We were in the process of developing it in the middle of the pandemic, and that basically put a halt to the progress that we were making. And after things had settled down with COVID-19, the team sat down again, and we discussed, trying to move forward with the implementation. And ultimately, that came to fruition March 1st of 2021. And so this April, for us, marks a year of a fairly successful program.
So how many people usually will go to the stations, Lieutenant?
So it really varies, Chief, depending on the month. The numbers have ranged from anywhere to maybe one a safe station encounter to, I would say, a max of 8 to 10 in the period of 1 month.
Oh. So that's a good amount. And when they get to the station, they're treated by EMS personnel, paramedic, is that what happens? So just bring us through that procedure.
Okay. So the idea behind safe stations, and it actually came from one of the first departments in the country, to my knowledge, to start the program was the Manchester Fire Department in Manchester, New Hampshire. And I believe they've been doing it since 2016. And the idea is that Manchester used their fire stations as access points for community members who are looking for assistance with substance use disorder or problems in and around addiction of various forms. And basically what occurred was the Providence Fire Department in Rhode Island was faced with the challenges that they had in front of them in regards to handling the high volume of overdose calls that they were responding to, and trying to look at proactive ways to help community members afflicted with substance use disorder. So what happened was a gentleman by the name of Chief Zachariah Kenyon went out to Manchester, learned about the Safe Station program down there, and brought it back to Providence. And ultimately, the Providence Fire Department held a press conference, I'm going to say on or around some date in 2018. And Director Oliveira, the EMS director here in the city, and myself attended the press conference. And Director Oliveira felt, after hearing about the program, that it would be of use here to the community members in Fall River. And so the idea, again, is essentially the same, to use the Fall River Fire Department fire stations throughout the city as access points for community members who are looking for assistance with substance use disorder. And although most people think of problems with opiates, we don't discriminate. We're willing to help anyone with any type of substance use disorder, from alcoholism to cocaine and crack, to benzodiazepines or opiates. And that's the goal of the program. What happens is the program is in effect from 7 a.m. until 9 p.m. Every day of the week. When you come to one of the stations, and you may interact with a member of the fire department who's a firefighter or a paramedic or EMT, you'll just let them know that you're there for a safe station, that you're looking for some assistance. At that point, one of the medical rescues in the city will be summoned to the station if they're not there already. They'll do a quick medical screening to make sure that there's no acute medical emergency that would require transport to a hospital immediately, in which case we would take that necessary action. But assuming that there's no immediate medical emergency that requires immediate life-saving intervention, they would check your blood pressure, your pulse, and other vital signs, and then contact a member of Mike Bryant's staff and his recovery coach and of his recovery coaches who would then respond to the fire station. I'll let Mike briefly talk about what it looks like from there because that's really his wheelhouse.
I have one question before, Mike. What if somebody goes in there after 9 o'clock? You said it's from 7 to 9. Then what happens?
So what happens generally is, and the reason it's 9 o'clock is not that the fire station closes.
No.
It's essentially that in the beginning we had a number of limitations that we had to face, and the team, including Mike and myself, sat down, and our goal ultimately was to have the program be up 24/7. But that would have taken significant time, and it would have delayed the program. And we felt, I think, the team, and it's really a team effort. And I don't want to say that Mike and I are here today, but Safe Stations is really a reflection on this community and the organizations that made it possible. And it's not just myself and Mike Bryant. St. Anne's Hospital, Stewart Healthcare has been instrumental in assisting us. Ron Audette, who was supposed to be here today but due to unforeseen circumstances could not attend, has been a member of the team. Bay Cove Human Services at Boston Medical Center, Jamie Shorten's been involved and been helpful to us, and they're a partner in this venture as well. And then STAR has been involved in the process and been instrumental in the program as well. Am I missing? Is there anybody I'm missing?
No, I don't believe so.
And the Fall River Fire Department, obviously.
Yeah, of course.
But what was to your question again, which was?
What if
Why
they
till
go to
9?
the station after 9 o'clock? Then what
We didn't
happens?
really want to, so I think we could have made it 24 hours a day, but it would have resulted in a significant delay. And so I think the team felt that let's roll it out, let's get this program out there, let's start helping people because the need was present, right? And so I think the decision was made to implement it with the limited time constraint of 7 a.m. to 9 p.m. And then down the road when the time was right and when we were able to sit back down and reconvene and find the means to talk about the discussion of bringing it 24 hours a day. Would you say that that's...
Yeah, and we also learned from Chief Kenyon as well, like what was their peak hours in Providence? Like what was the bulk of their peak hours? So like Lieutenant Lonardo said, if we were to implement something and roll out, what would be the most active hours in which we feel that our community would need our support the most? And based upon his data in Providence over the course of the year and a half in which at that time they were rolling, that was their peak hours. So we modeled it by Providence's already success rate that they had. So we felt that their community basically mimicked ours. So we felt that they had a good solid model within that time frame. So we modeled it from theirs and they were pretty much accurate. We rarely got within the time frame after that 9 p.m. time frame. We rarely got calls after that. And what would happen is they would make a next day referral. So if someone had come past the hours of 9 p.m., we would gather that information. We have a contact form, and that would get submitted to the office. And then we would follow up with that individual immediately that morning after and try to make that contact and provide that individual with the support they needed.
Now, I know Stepping Stone has a lot of programs. Substance abuse, transition back into the public. Can you speak of that? Speak about those different programs that you offer at Stepping Stones?
Yeah, I mean, it seems like we're always adding and trying to implement the needs of our community. There's probably close to 20 different individual programs and different projects under Stepping Stone's umbrella. You know, formerly for me, I was in homeless services. I oversat the First Step in Homeless Shelter prior to developing the Peer Recovery Support Division. So I oversee the recovery coaching programs in the Recovery Support Center. But Stepping Stone offers an array of behavioral health, homeless services, and peer recovery supports from Fall River to Barnstable County. and in New Bedford and locally in Fall River. But there's an array of supports that they can check out on our websites and Facebook and pretty much probably every other social media that I'm not even aware of or utilize at this point. But yeah, so.
Because I know you have programs for women and for men
Yep.
to transition from substance abuse back into the public. Mm-hmm. And all these residences are basically based on North Main Street, correct? A lot of them?
A lot of them, yeah. We have residential programs for male and female on North Main Street. We have a co-occurring program for folks that identify with mental health and substance use disorder on North Main. The Recovery Support Center is formerly where the First Step In shelter is at 175 North Main Street. Outpatient clinic is on North Main Street. And the First Step In shelter is now on Durfee Street at its new location. But we do have other programs that are scattered throughout the city, not just on North Main Street as well, scattered site supportive housing and other facilities that Stepping Stone has under their umbrella as well. And New Bedford, our programs are growing rapidly in New Bedford as well. We have a recovery coaching program in New Bedford. We have a medicated supportive recovery program, Project SOAR in New Bedford, which provides another form of recovery support and a reentry program as well. So folks coming out of incarceration seeking assistance in reentry.
So you work closely with Rosa Maduro at First Step In as well?
Yeah,
Okay.
yeah, very close.
Now, is that the same program or is it a different program that she has that you have?
Different. So Rosa oversees all the homeless services. She's the director of homeless services. So she oversees all the residentially challenged. I like to refer to that word rather than homelessness. But so all the folks that are seeking shelter and supportive housing, those are the programs that she oversees. So she does a fantastic job at overseeing all those programs. Mm-hmm.
We see a lot of people on the street corners.
Yep.
And collecting money, and a lot of people say they're substance abuse. That's why they're out there. Is that a true statement? Because that's what people say. Well, they must be in drugs, and that's why they're out there. Or
I think of course. Some, yeah, I think some may be. I think it's easy to cast judgment and say that all are. Mm-hmm. I think that's the cop out. I think that's the easy thing to say. I think that's also the ignorant thing to say. But I can tell you from overseeing that shelter for 8 years, I think I can tell you without a shadow of a doubt that that's not 100% accurate. I think those that are homeless, probably 70% of them identify with a substance use disorder, and there's also that 30% that are out there that don't, that are just struggling every day, folks in the city that are just trying to make it, that may have other issues that they need support with. But it's quick to cast judgment, I say it time and time again that, this city, for whatever reason, is still heavily stigmatized. And that's something that, my staff, my agency, and the people that we surround ourselves with and the other stakeholders and partnership that we collaborate with work very hard at reducing the stigma within our community because it's a problem. It is. I feel it is anyways.
Over the years, prior to Summer's Porch on Bay Street, the overflow shelter,
Yep.
we've housed people in different cut school when we had opened up a shelter in the wintertime. Mm-hmm. And you see the same people over and over and over, and they're down and out. It's not like they have substance abuse. They're just people that are down and out.
Yeah.
And it's unfortunate. But when you have a program such as your program and safe stations like the fire department, it's good for these people that they have some place to go.
Yeah.
Because otherwise they'll be roaming the streets and no place to go.
Yeah.
And it's the help that everyone is giving these people today. It's incredible when when you look at a situation, somebody in that situation, and there's so many hands out to help these people, like your programs. You know, I was looking at the program today online, and there's so many different programs for women, for couples, and for women with children, homeless women, that you people help as well. Can you speak on that at all? Or?
I've been disconnected for the past couple of years as far as homeless services and the support that they do, but I know they do a fantastic job. I know they work tirelessly in providing the supports, and again, I know that from firsthand experience, the countless hours that they work. But there's only so much that they can do. There's only, you know, there's only so much within their means that they can do, right?
Yeah.
Just on my end as well, there's only so much that we can do to provide the support within our means, right? When we started the Safe Station project, you know, we did it with really no money, little to no money. You know, it was a matter of people were dying at such a rapid rate, and they were not seeking assistance because of various different reasons, of either not knowing how to access supports or fearful to access supports because of the current climate that we were in, whether it was COVID, because that's what, when we developed this project, we were in the peak of COVID. And I'd like to paint this image real quick, if I may. Okay. So in the peak of COVID, you have people that were in recovery, right? Or trying to access recovery. So myself included, okay? And you're used to an ebb and flow of things. And you have folks that are going to their recovery meetings, going to their typical recovery supports, maybe counseling's involved, maybe even churches involved. Maybe there are these things that kept people well that they needed, and kept people well for a very long time. And then COVID hit. And then at no fault of their own, all this got snatched away like that. So now you have people that were already struggling or possibly struggling or wanted to access recovery supports and couldn't. So all this stuff started to rapidly happen. We all seen this pattern of all this terrible stuff happening. So now when we try to implement all these good things that we had the ability to do, people didn't know how to access it, whether it was fear, whether they didn't know where to go. So we tried to market this campaign like, we're here to help, this is how you do it. And just getting folks to come through the door was a task. Just getting folks to come through and call a number, or to go to the fire station just to say, hey, I need this help, because they've been so isolated for such a long time. Just taking that first initial step was such a huge deal in itself, was just amazing.
One of yours saying is no wrong door to recovery.
That's right.
And I think you just spoke about that.
Yeah.
But can you talk a little more about that quote that you always have, no wrong door to recovery?
Well, there's a stereotypical way that you should have, that this path is the only path, or this path is the right path. Well, there are many. I don't really care how someone finds their recovery. It doesn't matter to me, and to be honest with you, it's none of my business. I want people to be well. I want people to find happiness, and I'm sure you do, and I'm sure Lieutenant Lonardo, I'm sure everybody wants people to be well. It doesn't matter, and it's none of my business how they capture that and how they find that. So if their first point in contact or their first initial experience is through a fire station, then that's a beautiful thing. I really don't care.
Certainly is a beautiful thing.
You know what I mean? I really don't care. If it's through the police station, through maybe a not so good experience, but that experience winds them to get them where they need to be in long-term recovery, then that's a beautiful thing. So I don't really care. As long.
Point. Is the police station a safe station as well?
No, not at this moment.
Not at this moment. Okay.
Yeah, not at this moment.
Chief, I just wanted to touch briefly on homelessness here in the city of Fall River, and say that the men and women, first of all, what I want to start by saying, I happen to be the face of Safe Stations for the Fall River Fire Department, but the work really is done by the men and women, the members of the EMS division who are out there every day treating these patients, and I'm sure Mike feels the same way about his recovery coaching staff. They're the ones who are answering those calls. But I do want to say that having worked on the ambulance and then on Squad 11 for the fire department, we're no strangers to encountering members of the community who are struggling with homelessness and substance use disorder. And it's, I'll speak for myself, it's not lost on me when I was out there that we're very limited in what we can do, right? We're a reactive service. People call us, they're experiencing a medical emergency. You know, and in the case of substance use disorder, let me, you know, tell you how frequently that we encounter that. You know, someone's loved one is on the floor not breathing, and they're in cardiac arrest, and we're faced with that situation. And the acuity of that is that we try to, oftentimes try to resuscitate that individual, and sometimes we're not successful. And the family's left with the heartache, and the community's left with the heartache that leaves behind. And we're limited, right? We're limited to that role. We'll leave, we'll transport their loved one to the hospital, but it stays with us, I think. It stays with us, and it lingers, right? And it's not lost on us that the family has to handle that tremendous loss in many of the cases. And I want to piggyback on what Mike said. You know, some members of the community just find themselves, unfortunately, in dire circumstances. I don't think anyone would ever choose or make a conscious, rational decision to be homeless, but we encounter people who live in their vehicles. You know, even I've encountered in the course of my career families who are living out of a car because they don't have the means to have an apartment or a home. So it's not lost on us. And the Safe Station program really gives us an opportunity, and for the first time, to be proactive in a way, right? To open the doors of our stations and say, hey, if you're a member of our community, and if we can help you and potentially save your life, albeit in a less dramatic way, right? Help you before you overdose, help you get treatment, help you make a decision today that will change the course of your life, potentially. That's a big opportunity for us. It's an opportunity that I take very seriously, and it's an opportunity that Director Bryant's staff take very seriously, and it's, quite frankly, something the men and women of the Fall River Fire Department take very seriously. So I have to be honest with you, it really, it makes me happy that we do this. I think it's another way that we can, it's another tool that we can add in our arsenal to help the community here, and some of the most at-risk members of our community. You know, we often, there are members of the community who are extremely at risk, right? Your homeless populations, those who have substance use disorder, who may also suffer from be residentially challenged. Is that correct? And being able to help those individuals who are most at risk is rewarding, both as individually and as an organization. And it's something that I think you know, Safe Stations does, but it's something we need to continue to try to find ways to do moving forward. Just quickly, I wanted to briefly mention we've been doing this for just over a year. We have not had any major problems. If someone shows up after hours, we'll generally get their information and forward it on to Director Bryant, whose agency will reach out. Or if they're interested in going to the hospital, we're able to transport them immediately to a hospital. And they can meet up with a recovery coach at the hospital either the following morning or later on that night. And if they're experiencing a medical emergency, then obviously they would go to the hospital. But so far, the majority of what the program's seen is people facing opiate addiction. That comprises 55% of what we've seen. And then we've seen 21% of it was related to people looking for assistance with alcoholism, 21% cocaine, and the remaining 3% was comprised of various different forms of substance use disorder. But we've been, I would say, in a majority of the cases, we were able to get the people, Mike and Director Bryant and his staff were able to get a majority of these people into treatment within, I would say, within 12 hours, if not immediately. Is that a fair analysis?
Yeah, very, very little to do with me, and more to do with my hard-working staff. But yeah, so we had 56 encounters that have came through our 6 stations, and I believe all but 2 were placed in or received the support in which they were looking for. I don't know percentage, I'm not that smart to figure it out, but I know that's a pretty, if that was a batting average, that'd be through the roof. So that just shows the success of this project and the trust that it's building within the community, right? So 56 people over a 1-year period, which still is in its infancy stages, and we really haven't had a huge marketing push. This is all basically word of mouth at this point.
Well, I think it's a great service that you're rendering for the citizens of Fall River, and I want to thank both of you for coming on the show,
Thanks for having us.
Mr. Bryant and Lieutenant.
Thank you.
And keep up the good work.
Appreciate it.
Thank you.
That's our show. Thank you very much for listening.